Welcome to Taking Up Space, the podcast with conversations exploring what it means to inhabit our bodies fully without shame or apology and reconnect with our innate wisdom to find healing and body liberation. I'm your host, Cassie Krajewski, a licensed clinical social worker, certified sex therapist, and certified body trust practitioner. For over 10 years, I've worked with women and marginalized folks to reclaim their bodies, their inner knowing, and their lives in a world that often seeks to diminish their voices and experiences. In this podcast, we'll unpack the societal norms and expectations that interrupt our embodiment, like trauma, oppression, illness and pain, and the social constructs of gender, race, sexuality, beauty, health, and weight. My hope is that through this podcast, we'll learn to drop into our bodies and give ourselves permission to occupy space, physically, emotionally, relationally, and intellectually, with more confidence and authenticity. Join us as we challenge societal norms, explore what it means to find wholeness and reclaim our right to take up space as an act of resistance and body liberation. While this podcast might feel therapeutic, it is not psychotherapy and doesn't constitute a therapist-client relationship. This is a good time to mention, too, that this podcast will at times use adult language, so listener discretion is advised. If you are interested in diving in deeper, make sure you check out my online shop where I'm currently offering my Taking Up Space workbook for free. This workbook includes thought-provoking exercises, reflective journal prompts, and actionable strategies that can help guide you towards a deeper understanding of yourself and your needs and cultivate a more profound sense of embodiment and your own liberation. You can find this workbook and other resources at my website. That's inneratlastherapy.com/shop. Hey there, welcome back to Taking Up Space. Today's episode, we welcome Dr. Mara Gordon, a family physician and medical educator, who's going to share her journey towards size-inclusive medicine. Dr. Mara's career is as dynamic as it is impactful. She is based in Camden, New Jersey, lives in Philly. Dr. Mara is also a writer who has made it her mission to transform the way medicine approaches body size. Dr. Mara also shares that she is currently working on a book focused on body liberation, challenging medicalized fat phobia. Super excited for that. Her work with size-inclusive medicine challenges the traditional weight-centric approach, advocating for a perspective that prioritizes overall well-being over arbitrary numbers on a scale. Our conversation is really enlightening. She is going to share more about her journey moving towards size-inclusive medicine, and she also reflects on the harm that she has caused and others in the healthcare field have caused by a weight-centric paradigm and practices. And Dr. Mara shares around how the recognition of realizing that approach wasn't actually helping her patients achieve their health goals, that really helped her see how stigma was contributing to people disengaging from care and also providing less optimal care. And through this realization, it propelled her to dig deeper into the scientific literature, where she found robust evidence against the effectiveness of diet and exercise as long-term strategies for weight loss. And this discovery for her is a pivotal moment in her transition to size-inclusive medicine and aiming to practice evidence-based care that truly benefits her patients. Interestingly, Dr. Mara, as a medical educator, also shares with us a bit more about what she's seeing with this new generation of medical students who are passionate about size inclusivity. Despite the entrenched bureaucratic structures promoting weight-centric approaches, Dr. Mara is hopeful. And she says the kids are all right. So I'm excited to share that with you as well. Our conversation will also explore, for those of us looking for a size-inclusive practitioner, some tips or ways to advocate for yourself within healthcare. I really appreciate Dr. Mara's expertise, her perspective, and how she holds the nuance of providing size-inclusive medicine. Here's my conversation with Dr. Mara Gordon. Hey there, Dr. Mara Gordon. Welcome to the show. I'm so glad you're here.
Yeah, thank you for having me. Such a pleasure.
Before we dive into any content, you could share a bit more about who you are and the work that you're focusing on right now at this point in your career.
Yeah, thank you. So I'm a family physician. I'm a primary care doctor in practice in Camden, New Jersey. I live in Philly, so just a few minutes away. And I'm a medical educator and I'm also a writer. And I have gotten interested over the last couple of years. I think the reason I'm here joining you today, Cassie, is my interest in what I like to call size inclusive medicine, which is a topic I've been writing about and speaking about and really changing the way I practice medicine to align with the ideals of size inclusive medicine, which I define pretty simply, which is I just don't yell at my patients to lose weight. And we can talk about that. Yeah, definitely. Yeah. So we can talk about some of the nuances of that. So in addition to being an advocate for primary care and taking care of patients of all ages, I am an advocate for size inclusive medicine too.
Amazing. How did you arrive at that place? I always love hearing specifically on the medical side of things. What were the pivot points for you? Because this is not standard practice in primary care and family medicine, as far as I'm aware. So I'm curious how your own story, perhaps, or other factors influenced you making this shift.
I really pinpoint my interest in this topic from reading. I love reading. I've been a lifelong reader. It's just always been such an important part of my life. And I think the story sort of illustrates why reading for me is so important because it informs every aspect of my life. And I want to say maybe 4 or 5 years ago, something drew me to reading books by some fat positive authors. And I think it was a confluence of factors. I think my own body was changing. And so I was interested in more fat positive representation of bodies, although they weren't always that positive, which was interesting. A lot of these were pretty heart-wrenching books, but just reading about others' experiences. And I read, there's a handful that really influenced me. Hunger by Roxane Gay. Yeah, a beautiful book. Heavy by the author Kisei Limon. And Shrill by Lindy West, a trio that I read in quick succession. And it was interesting. I saw myself in them and the authors, but I also saw myself in the doctors that they wrote about interacting with. And that was planted the seeds of maybe my approach, my weight-centric approach isn't working. Maybe I need to change what I'm doing. So that's sort of the origin story.
It's interesting because that was a little bit of my introduction into this work too, was reading books and reading lived experiences and reading about a different framework that just otherwise was not a part of my life nor my education as a therapist or anything like that. And it's so interesting to hear how people come to this work, and it's all the people who've gone before and have paved the path and given us some real thought leadership of different ways to relate with our bodies and their size and how they change over time.
Totally. And I think just a testament to how important art is, right? That medicine is so focused on science. And in my other role as a medical educator, I focus a lot on medical humanities, right? And using humanities as a tool to become better doctors for my students. And this, to me, is just like such a perfect example of how art informs my practice of something that's supposed to be an objective science, which it absolutely is not.
Yeah.
The foundation of medicine, the way that we teach it in this country is just, we like to have objective answers to everything. I'm not a scientist. I absolutely respect scientists, and I'm really grateful for them. And I feel like I put science into practice every day when I prescribe medications or recommend treatments. But there's this idea that there's like a right answer on the multiple choice test when you're becoming a physician, right? There's always one right answer. And it was shocking to me when I started practicing on my own. That's totally not true. It's rare that there's one right answer. It's a relief when there's one right answer, because that means it's actually makes my job easier, right?
Yeah, that's a lot more controllable.
Totally, right. But I'm joking. in all seriousness, what drew me to primary care in particular is that there's an art to it, that it's really nuanced. It's really complicated. It's thinking about how people tell stories about their bodies, how that intersects with their social environment, with their emotional environment, and then their physical health. And my job is to synthesize all of that and think about recommendations I can make to help them achieve their health goals all in 15 minutes, right?
It's so much pressure on primary care physicians to be efficient and
right. Yeah.
So you said you don't yell at people to lose weight, right? The word you do. Why not? Talk to us about all the different ways maybe that size inclusive medicine like makes sense to you as a health provider.
Yeah. So I had this origin story of reading, and it just got me thinking about the way that I address weight and body size with my patients. And I sensed over and over again that my sort of weight-centric approach wasn't working. And that was the approach I learned in medical school, that you look at the patient's body mass index. In our electronic medical record, it's literally like a bright red button on the side. And I'm looking at a sort of patient's records, and there's like a flashing, I mean, it's not flashing. There's a bright red sign if their BMI is over 26. And just that you always needed to bring it up, right? That it was good medicine to counsel patients about losing weight. And that was just completely not reflected in my clinical practice. The more experience I got, a patient would be in for a cold or a cough or whatever. And I'd say, oh, have you thought about trying to exercise more or change your diet? And I could see the patients disengage. And I'm not proud of this. I wish that I had seen the light earlier, but I think it's really important for me to talk publicly about the transformation that I've had over time and my change over time. One, because I think it's good that we can change and learn. That's part of what drew me to medicine, is that it's always changing. What I learned in medical school is different from what the standard of care is now. And that's part of the fun of being a doctor, is that we always talk about lifelong learning. But I think there's lifelong learning in a sort of social context too, right? And so even though I do feel some shame when I talk about my more weight-centric past approach, I hope that people can see that I'm really making an effort to do better and try to undo some of the harm that I've done in the past. So yeah, I think I just noticed over and over again that my asking people, have you thought about changing your diet? Have you thought about jumping on the treadmill a little bit more often? It just wasn't effective, and it wasn't helping the patients achieve the goals that I had intended by bringing it up, right? And it was actually causing a lot of harm. So I could see over and over again that it made patients feel uncomfortable. It made them feel stigmatized. It made them not want to come back to see me. And so I had to do a reckoning. What am I doing wrong? Why isn't this working? This is the framework that I learned in my education, and yet there seems to be this real disconnect between the way that I've been taught to approach sort of body size issues and what really works.
Right. I really appreciate how you acknowledge the harm that you've caused in the past. I think that feels really healing and validating for me, being like a person who grew up in a fat body and was just so shamed in every pediatric appointment and even as a emerging adult. And like I felt so bullied at my doctor's office, and to hear you acknowledge and say, yeah, that weight-centric medicine was something I did, and I'm also not okay with it now, and I'm changing it. It feels really important. And I've talked with a number of other people on the podcast who, in some kind of form of healthcare, whether it's physical therapy or mental health care, where they put forth like a weight-centric paradigm and all like the cultural narratives around anti-fat bias and are not doing things differently. I think it's important to acknowledge where we were and like how that informs now where we go and what we do.
Yeah. Yeah. And thank you. And thank you for sharing that. And I'm sorry that you had those experiences. I did too. And I think it's a hope that by talking about it more openly that we can all start to do better. Right.
Yeah, absolutely. Yeah. We need to we need to tell the truth of our journey and our trajectory, I think, in this work.
Totally. And I hope I continue to get better.
It's not over.
Totally. Yeah.
Yeah. I think this work is professional for me, but it's also the personal work. And I think this is speaking to some of that too. Like,
totally. Yeah. So I started, just to tell a little bit more about how I've changed my practice. So I just started noticing that my approach was not effective at the intended goal, which was weight loss, and was seeming to cause harm. And then I was looking into some of the literature on it, the scientific literature on it. And I had this moment of, oh my God, what are we doing? And I started learning that there's really robust evidence that diet and exercise are pretty ineffective as long-term strategies for weight loss. And so me saying, hey guys, go to a spin class, just really didn't have an evidence base behind it. And I try really hard to practice evidence-based medicine. I talk with my students, I grill them, say, show me a citation for why you want to make this treatment recommendation. And here I was for doing something every day that really didn't have an evidence base. And that there is evidence that it really can cause harm, right? So that this type of language, really weight-centric language in the primary care office, particularly when it's not patient-initiated, right? So when it's not a patient-identified goal to talk about body size or cardiovascular health, and we could talk about the difference between those things in a little bit, but when it's not a patient-identified goal, for me to bring it up, there's a ton of data to show that's really stigmatizing, and it makes patients just not want to come back and see me, right? So how could I be doing my job if they don't even feel safe in my office? So that literature was what got me interested in backing off on sort of initiating discussions about weight loss, bringing it up when that was not the main reason people were there to see me, which is really harmful. And interestingly, now even though learning that diet and exercise are not effective for weight loss was one of the threads that drew me to practicing more size-inclusive medicine, I've actually changed my tune. Now my approach with my patients is, I actually don't care what your body size is. I don't routinely look at the number listed in the electronic medical record, except in a few particular circumstances. But I actually really care if you're moving your body regularly. And so it's interesting that realizing exercise was not a great tool for weight loss was what got me interested. But now I'm like, actually, weight loss may not be the most important thing for your health, but regular movement is really important for cardiovascular health. Now, in clinical practice, that can be challenging sometimes. Exercise is so tied up with diet culture that I always say, when I say exercise, my patients hear weight loss. I'm working on my own counseling skills to try to disentangle regular exercise from being about weight loss. But it is interesting that I've reversed course in some ways on that. Yeah, it's funny. Yeah.
Yeah, the word that I use with my clients is movement, because it doesn't seem to have the same kind of connotation and loaded meaning on it. And I agree with you. I think there are certain aspects to our relationship with food and movement that are super relevant to health, but body size doesn't have to come into that, right? That's
totally. Yeah. How do you frame it with your clients? Like when you talk about movement, how do you initiate those conversations to start thinking about it as a practice that might be really important for our overall well-being, but isn't necessarily a tool for attempting weight loss?
I usually cushion this in of thinking about what it means to be embodied and be in your body versus objectifying your bodies. I work with a lot of folks who have had a history of disordered eating or an eating disorder, and as a result have just been really cut off from their body and instead paying so much more attention to the external rules of diet culture or toxic fitness culture or whatever. I invite them to go back into their body and ask themselves some like curious questions of what feels good in my body. Can I notice when I'm tired and honor that? Can I notice that I have a lot of like wiggly energy and I want to honor that? But I also really emphasize for some people, especially in recovery from an eating disorder or disordered relationship with movement, sometimes we need to take a break from movement. And that's like the healthiest behavior that you can do because it's just been so co-opted over time. It's a lot of collaboration, working together, having people really clue in to what's feeling right and good and honoring in their body and re-scripting what that can look like. A lot of education around like all the systems that exist to create these body hierarchies, and especially how that shows up in movement culture is its own kind of unique thing. Having people look critically at all of these like external factors that inform their roles, that interrupt their embodiment, can be a really helpful inquiry to get people reflecting on what actually serves me, right? This is my body. I get to make choices of my body. And so I don't emphasize that movement is a mandate. I think movement of some kind is probably going to be a health behavior that many people choose, but not always, depending on what's happening in your life, right?
Totally. I really respect that. Yeah. What's coming to mind as you're talking about that is my toddler.
Yeah.
And I'm actually thinking about this recently. I have a 3-year-old. He's so much fun. And he is just so in his body in a way that I want to try to reclaim for myself. I've actually been thinking about this a lot recently. And he is so unself-conscious and is just so free in his body in a way that I love, and also interacts with my body and my husband's body in ways that are just so unself. And he never judges what I'm wearing, how my hair looks, and he's 3. And he eats when he's hungry. He also does a lot of stuff that is not great. Like he would never brush his teeth if he had his way, right? So I think there's like some limit to the metaphor, but I do think that I watched his relationship with food, with running, with jumping, with just joy and unself-consciousness that I want to get back for myself. And it's interesting because I think when I think about my own relationship with my own body, right, and my working on body acceptance or body liberation for myself, I actually think becoming a parent has been really helpful for me in a lot of ways. Just little things, right? Like so much of parenting is so physical. And just, I want to wear comfy shorts when I go hiking with my son so that I can do what I need to do. And nobody is going to look at my legs and my shorts, right? I've actually found parenting to be a sort of reintroduction to getting in touch with my own embodied self, both in watching my son get to know his own body, but also me wanting to be unself-conscious and free in my own body so that I can be the kind of parent that I want to be. And this is something I've been reflecting on recently, and that really comes to mind when I hear what you talk about, what you work with your clients. It's funny.
I have a knowing smile because I have 2 toddlers as well. And I read, I think when I look at my kid or any niece or nephew or whatever, this has always been ours. Like this is a birthright, our relationship that's intuitive with movement and food. And then it's just gotten so co-opted. And so when we're doing embodiment work or if we're pursuing body liberation, it's just like going back to what we know. It's like a remembering versus like a learning.
Like that. Yeah.
For that. And yeah, kids are a beautiful example of what needs to be embodied. And it's so playful, right? It's lighthearted and like inconsequential in some ways. And I think that's a really anchoring concept to come back to.
Yeah, I love that. Totally.
I know so many people listening don't have you as their physician, unfortunately, so you can't serve the world. But some of the work that I help folks do is like, how do I navigate healthcare with a doctor or physician that may not be size inclusive, right? Or how do I find a size inclusive physician or healthcare practice? Do you have any guidance for folks as far as maybe we can start with like, how do I find someone who's more size inclusive? And then if I don't have someone in my area for whatever reason, or I can't access one, how do you support people in navigating the weight-centric healthcare environment?
Yeah. First, I want to put in a plug for a new organization that I am a part of, which is called the Association for Weight Inclusive Medicine. And we are an official new professional society for physicians and for advanced practice healthcare providers who are interested in removing ourselves from the weight-focused paradigm that dominates healthcare. So check out AWIN. We're pretty new. I hope that in the future we may be able to have resources for patients with directories of healthcare providers. We're not quite there yet, but that's one cool resource just to get started with. And we're growing. There's so much interest in it. It's really inspiring to connect with colleagues all over North America who are committed to this kind of work. So that's cool to realize that there's some strength in numbers. It's weightinclusive.org.
Okay, I'll link it in the show notes.
Yeah. So that's a good place to start. A lot of just real basics, right? That a lot of doctors have profiles online and will list sort of our clinical interests, clinical expertise. And this is particularly like when finding a primary care doctor. For specialty care, we can talk about that in a second. But yeah, for sort of primary care, basic general practitioner, just look on physician pages and see if they have anything about the health at every size movement, which is a wonderful movement that I absolutely identify with, but is a little broader than our work with weight inclusive medicine because it really includes mental health care professionals, nutritionists. It's a broader net. But you'll see doctors who write health at every size on their profile page. That's always a good sign. There's a lot of folks who don't. Word of mouth is great. So asking around for recommendations. I have a long list of size inclusive healthcare providers that I'm in community with really across the country, but particularly in my region. So if you have friends who are interested in, weight neutral care, ask, who do you see? Can I get a list of names? Things like that. Then once you're narrowing down a practice that seems like it might have a more size inclusive vibe to it, just calling ahead and saying, I'm interested in a more weight neutral approach is one easy thing to say. Is this doctor okay with me not being weighed at appointments? Right?
Yeah,
that's a sort of
great question.
Good barometer. Yeah. And I will just caveat that there are situations where a patient's weight is really important to their care. But if a doctor's not even willing to talk about it with you, then that's a red flag. There are specific clinical scenarios where a patient's weight is really important to their care. In pediatrics, it still tends to be pretty important just to make sure that kids are growing. So I am not in the practice of just blanket not weighing my pediatric patients because I don't think I have great evidence to show me that it's totally safe. But is the doctor willing to let you turn the other direction and not know the number when you're weighed if the doctor says that weight is important? Are they willing to weigh you after you've had a conversation about why weight might be important for this particular visit? Just how willing are they to negotiate about those kinds of little things? I think is a really good place to start. Mm-hmm. And I think a lot of people don't appreciate that a lot of doctors are totally open to conversation and self-advocacy, right? That if I'm just meeting you for the first time and I don't know anything about you, I have a sort of script I go through with new patients, how I introduce myself, the medical history. But if I know from the get-go that you have a history of disordered eating and discussions about weight are very damaging or upsetting to you, of course I'm going to approach it differently. I think feeling empowered to let the physician know ahead of time that you are not interested in talking about weight, or are interested in talking about it in this particular context, or initiating discussions about it, but not wanting to be told to do XYZ about your weight. I like to think that a lot of doctors are really open to that, more so than you might imagine, right? We've been trained, unfortunately, that we should tell our patients to lose weight. And it's hard for doctors to break out of that mode if they don't know anything about you. But if you advocate for yourself a bit, you shouldn't have to, but I do think it can go a long way. And most doctors are really open to that feedback.
Yeah, I think that's huge. I know when I was first learning about, I have options in healthcare, I get to advocate for myself. I think there's such a power hierarchy that existed when I went into the physician's office that I wasn't aware of how it was silencing me or shrinking me and being a partner in my own healthcare versus being dictated to or told what to do. And I love what you're offering here is an invitation to advocate for yourself in your own healthcare. And also trusting if how your physician responds to that is negative, you have options. You don't have to continue
Really?
visit, you have to continue that provider. There's
Totally.
just lots of alternatives to explore.
Totally. And I always say I have a lot of friends and colleagues who, I joke, are not quite as radicalized as I am, but are interested in the advocacy work that I've been doing and curious about it. So many people say, I still want to know my patient's weight, right? Like they're not willing to completely stop weighing their patient, but are absolutely willing to work with you as a patient to say, you don't need to look at the number on the scale, or I won't tell you what the number is if you don't want to know. I think that there's a lot of doctors who may not identify as being size inclusive and maybe aren't as totally on board with the work that I'm doing, but are nuanced, kind people who want to do the right thing for their patients and are absolutely willing to compromise and work together to find a way of approaching it that feels good for both patient and physician, right?
Yeah, I think that's a good way to think about it. Even if I can't find a size inclusive advertised physician in my area, perhaps I can connect with someone and advocate for the care I need and not have the same amount of harm, right? Even if it's not super aligned with health at every size or a really group approach.
Totally. I always tell this story. I worked with a great doctor when I was in training who was just wonderful. And I remember seeing a patient with her, and the patient said to my colleague, to my professor, I come to see you because you're a health at every size doctor. And my colleague nodded and said, yes. And we finished up the visit. And then afterwards, she said, what's health at every size? And she didn't know what it was. And it's funny, now she has a thriving health at every size practice and has a ton of patients who come to her for that reason. But it also struck me that what they were responding to was that she practiced patient-centered care, right? That she worked with the patient to help her, it was a woman at that time, define her goals, think about her goals. She was not judgmental. She wasn't stigmatizing and aggressive, right? And the patient was responding to that. And so it didn't need to necessarily be a certain label that you see listed on somebody's physician page online. I think that just basic empathy, decency, human-centered care can go a long way, even if the doctor isn't proactively aligned with weight-inclusive medicine or health at every size.
One curiosity I have is, as I've gone through my own deconstruction work of diet culture and pursuing body liberation, there's so much evidence that shows that diet and exercise are not effective long-term solutions for most people, and weight is not an indicator of health and so on, and like the dangers of weight cycling and how that impacts health, all of those things. And yet it just seems like that does not get as much traction in compared to what people are getting educated in, maybe in their training at medical school or maybe ongoing. One of the things you are is a medical educator. I was curious if you had any thoughts around what that discrepancy is. How is this big body of evidence not being more widely incorporated into this conversation around weight and health and medical school training, for example?
Yeah, that's a great question. I guess I'll start by saying that my students are teaching me so much. They are really on the forefront of this work. Another shout out to medical students for size inclusivity. The leader of it is a student at my institution, Cooper Medical School of Rowan University. She's amazing. She's taught me so much about community organizing and building the community online. And she has chapters of MSSI all over the country, and they're really working to change the paradigm from the ground up. And I've learned so much from them. So the students, the kids are all right. We're in good hands. Our future generations of doctors. I do think there is a relationship between the extremes of body size and risk of comorbidities. There's conflicting evidence about this. I think it's really complicated. I think it's much more complicated than we give it credit for. I don't think it's reflected well in BMI, right? Part of the work I do is, we talked about decoupling exercise from body size. I try to decouple treatment of different comorbidities from body size too. So, right, how do we talk about diabetes in a weight neutral way? How do we talk about cardiovascular disease in a weight neutral way so that it's less stigmatizing? I'm still working on how to do that best. I do think there is evidence that very low BMI and very high BMI can put you at risk for developing comorbidities. Is it the only risk factor? No. Is it a lot more complicated than just BMI? Of course. But I do think that there's a link between particularly adipose tissue in our visceral organs, is what we call it. So basically like surrounding your internal organs, that can cause medical problems. Do I think that making patients feel bad because of that is good care? Of course not. In medicine, we want to look at the scientific evidence, but then we really struggle to communicate with our patients about the scientific evidence in a way that feels empowering and not stigmatizing and not discriminatory.
It's really tricky, right? Because how do you hold the space of weight is not the only indicator of health, right? It can be an indicator of health, but I don't think it's as weight dominant, perhaps, as maybe a weight-centric medical approach would want to make it in comparison to several other variables that are impacting someone's health status.
Totally.
Would you agree with that?
Totally. And I would say genetics, I think, are just so important for determining our risk for so many different things in ways that we don't fully understand. There's really interesting cutting edge work going on in this space around cardiovascular risk factors. Our tools for predicting cardiovascular disease are just really not that great. They're really blunt instruments. And there's really interesting work about trying to use are there different types of tests that we could order on our patients that would help predict risk of cardiovascular disease better than the tests that we're currently using. And a lot of those are totally weight independent. I see that in my clinical practice, right? I have so many thin patients with really serious cardiovascular disease who've had multiple heart attacks, open heart surgery, and their BMI is like 26. So it's much more complicated than the weight-centric approach would have you believe. So my goal is to try to help talk about those, like the things that we can, right? There's nuances and talk about the things that we can do to help feel empowered, feel in control of our health and being, and trying to remove some of the shame and the stigma and just like the baggage, the stuff, just all the weight stuff that we have culturally, trying to shed some of that so that we can talk more in a more productive way about how patients can feel in control of their own well-being.
Well, and I have to wonder too, thinking about my own experiences receiving primary care over the course of my life and just how much productivity pressures are on primary care physicians to do their visits in 15 minutes and how weight-centric medicine might be a more efficient, simplified way to offer interventions, right? Not all of my providers, but certainly at certain different points in my life, feeling like the primary care doctor didn't have the space to really be curious with me around other factors. There are systemic pressures put upon physicians that also might enforce it a bit. What's your sense of that?
Yeah, that's an interesting point. that you can pat yourself on the back and say, okay, I did my job. I told them to lose weight. There are, to get into the weeds a bit, like there are some financial and like administrative incentives that might increase it. As I mentioned about the bright red flashing BMI in the medical record, there's just basically doctors can like bill more. There's nuances to it. Your listeners are not interested in all of the nuances. But yeah, basically documenting obesity as a diagnosis and documenting that you counseled a patient about obesity can get you more money. It's not quite that simple. So that's one factor, right? We're up against some serious stuff. It's considered like a safety measure in some health systems. So I've talked to colleagues who work at federally qualified health centers, which are health centers for uninsured or underinsured folks, and they have national standards for providing good care in a way that working for a nonprofit health system like I do, I'm not held to quite the same standard, although there's basic standards of care that are universal. But yeah, in federally qualified health centers, it's considered a metric of how successful the practice is and how high quality the care is that they're providing, that they check a box saying, I counseled the patient about obesity, right? So there's just like a lot of bureaucratic layers of fat phobia in healthcare that when you start to peel them away, you're like, oh my God, there's so much more, right? And there's so many more examples that I could not bore you with because they're all really bureaucratic. But there's a lot of sort of administrative incentives to bringing up weight and documenting weight in the electronic medical record. So I think that's part of it too. But I think we're all living in diet culture. So I was talking to a friend about some of this work, and she was like, I just think we all have disordered eating. Yeah, totally. A patient the other day said to me that his pulmonologist started yelling at him about losing weight because he has sleep apnea. And he was this skinny guy, and he was just saying, lose weight, just yelling at me. And I think I was like, I wonder what that pulmonologist relationship is with body image and food and exercise. I think that we all have really disordered relationships with it, except our toddlers. They're doing good. Most adults really have experienced a lot of harm from this culture, no matter what body size you have. What you're seeing is human doctors who are existing in a culture that is really fat phobic. It's been honed through the lens of medicalized fat phobia, right? Where we learn in med school, like, always talk about this, always bring it up, always encourage your patients to lose weight. We're products of our culture. So
hearing that doctors are human too somehow feels like revolutionary to me in this moment, even though I know that's true. But I think it's the power hierarchy and all of what is built into some of our medical system as well.
It's okay to ask better of your doctor, right? Like you should be getting what you need in most ways from your relationship with your physician. You don't need to be too gentle on us. We can handle it. But I also think that understanding that we're products of our culture too.
You live in the culture.
Right. Yeah. And that culture needs to start doing better. Yeah.
Whoa, Dr. Mara, what a journey. I feel like we can keep talking, but I want to be respectful of your time. But I do have one last question for you, if that's okay. What does it mean for you to take up space in your own life right now?
Oh, thank you for asking this question. I was thinking about it before we met. And I think it's really about, I think motherhood has been really powerful for me in this regard. And not that one needs to be a parent to think about taking up space at all. I have so many people in my life who don't have kids, and everyone has a sort of different relationship with the kids in their lives. But for me, wanting to feel physical in the ways that feel good with my kid has been such an empowering experience. And a lot of it is so mundane. It's just about wearing the clothes that feel comfortable, hanging out with him and not feeling ashamed of my legs or ashamed of my arms or whatever. And certainly wearing a bathing suit that feels really supportive is also part of that journey, because little kids are maniacs in the pool and so high support bathing suits are also part of that experience. Watching him learn about his own body and just experience his own body and others' bodies, including my own, in such a pure, judgment-free way, and so outside of the judgmental gaze of society has been so beautiful for me and really transformed some of my thinking about my own body. And it's a journey. I still have bad days, but I'm so grateful for my son for teaching me to feel like a kid again in my own body.
Thank you for sharing that. As we come to the close of this conversation, if folks wanted to further connect with you or learn more about what you're up to in your work, how would you recommend that they do that?
You can find some of my writing on maragordonmd.com. I'm actually at work on a book in very early stages about body liberation and medicalized fat phobia. So I'd be very grateful if folks would follow along as I continue exploring some of these issues. And I'm on social media at maragordonmd as well.
Incredible. Thank you so much, Mara. I really appreciate you and your work and your time. And for everyone else listening, thanks for being here. I hope you all find some ways to take up a little more space this week. Thank you for listening to Taking Up Space. I hope you enjoyed today's episode and found it to be a resource for you in your own embodiment, healing, and body liberation journey. I hope you can continue the conversation with me over on social media by sharing your thoughts, offering your ideas and suggestions for future episodes, or just connecting. You can find me on Instagram at Inner Atlas Therapy. If you liked this episode and want to support the show, please subscribe, rate, and review the show in your preferred podcast platform. And share this episode with a friend. This ensures that more people can find the pod and will amplify our message of body liberation for all. If you haven't checked it out yet, I have a free Taking Up Space workbook available. This workbook will have you engage in self-reflection and embodied practices as you navigate your own journey of taking up space. You can find this free resource on my website, inneratlastherapy.com. I'll also link in the show notes some additional resources I've developed in my online shop to help you deepen into your own embodiment, healing, and body liberation work. Thanks again for being here. And until next time, I hope you join me in the resistance and find some ways to take up space this week. I'll see you next time.